Now let's discuss about therapeutic guidelines, which is basically one of the most important textbook that you need for your ADC exam, both for the written, the practical exam, of course, more for the written exam, but it's so important and it's something that you need to be really very well versed with, right? Because therapeutic guidelines is something that basically paves your way on how things are done in Australia. All right. So you have to be very well versed with therapeutic guidelines, every section of it, and it's so much important not only for the ADC written and the practical, but also once you are done with the ADC and you're working as a dentist in Australia. We often refer to therapeutic guidelines if we are confused about certain medication, drug dosages, certain patients when they have complex medical history, the precautions that we need to take. So it's so important, and it's basically giving you your step ahead towards the practice of dentistry in Australia, and that's what I'm trying to discuss in this video here. Like I said, it's one of the most important book for ADC, especially the written exam. It's one of the most important book for the ADC. Even the new version, because ADC released the new version, which is the version 4, which was released recently, the September 2025 version. We have included in our course of the written exam as well as the practical. And for the written exam, we have divided it into sections. We have revision MCQs for each chapter of therapeutic guidelines. We have multiple mock exams, especially for therapeutic guidelines. We have revision files for therapeutic guidelines. Now, can you imagine we have done so much for therapeutic guidelines alone itself? That must make you realize the importance of therapeutic guidelines, right? So if you have done so much in our course for therapeutic guidelines alone itself, you must realize how important therapeutic guidelines is, right? It builds your understanding, or basically it paves your way of understanding the practice of dentistry in Australia, because it has everything that you need in regards to, of course, it's not a textbook which tells you how to do things, but it tells you a lot regarding medications, dosages, prescription, medical conditions, emergencies, because you see these patients a lot in your day-to-day practice once you start working in Australia. And it's not only in Australia, even if you're practicing, preparing for ADC, practicing somewhere else across the world, it still helps you because it has so much important, so much useful guidelines. This is one book that you should be very, very well versed with, as ADC, especially in the written exam, relies heavily on this textbook. Okay, because it's Australian own publication, it's their own textbook. So that's what they're going to rely for the exams that they conduct, right? And because it's a text written book, initially it might seem a bit boring. Try to do it in sections, divide it, study each chapter individually. Don't binge read it. So do not binge read it. That is reading large amount of text in a short period of time. Don't do that. Try to divide it. Try to do it in section. And then, like I said, in our course, we have divided it already into sections, have revision MCQs for each chapter, each section of TG. We have multiple mocks, especially for TG. We have revision files, especially for TG. So all that helps you get very well versed with therapeutic guidelines, right? Now, even as a practicing dentist, once you start working in Australia, you will often open it and look for details. Example, medication, dosages, precautions with certain medical condition, medication condition, emergency management, and so much more. You will keep often referring to this textbook because every line or chapter of TG is how things are done actually in Australia. And that's what they rely their exam upon as well. I'll give you one tip. When I used to, when I sat the exam to go, when I was preparing, how I used to cover TG is that I used to replicate the TG medications and management of patients taking medical conditions or taking medications in accordance to what TG recommended. So when I used to treat patients, even when I was not in Australia, when I used to treat patients back then, I used to follow the recommendation that the TG has mentioned. which helped me remember a lot of stuff automatically because that's what I was implementing. So, for example, I had a patient who was taking a blood thinner. I had to extract a tooth. I used to refer to TG and see what are the precautions if the patient is taking, let's say, this medication. What are the precautions for it? If the patient has a spreading odontogenic infection, let's see what TG, what medications TG recommends and what dosages they recommend. And I used to do the same for my patients in my practice. That's where I used to develop an understanding and things automatically sat in my mind. And now, once I'm in Australia practicing here, I'm replicating the same thing. So, this is something that you can also do for those dentists who are clinically working. It helps you, understand things. For example, patient had an episode of fainting, how to manage it, because these are very common things, right? Patient was anxious, he fainted, what are the management steps? So I used to follow exactly what TG said for my actual patients as well, which helped me learn, which helped me adapt, and things automatically sat in my mind, right? So this is one tip that you can also implement when you're practicing and reading TG, right? Thank you.